introduce everyone. Thank you guys for coming and doing this, by the way. We have Matthew Roberts here, who's an Informatics project manager over at the Chicago Department of Public Health. VIVIAN HESSEL here, Director of Technology for Advocates, LAF. And then Matt Bruce, who's the Executive Director of the Chicago Workforce Alliance, Funders Alliance, excuse me. And yeah, with that, please.
Okay. Well, thanks everybody for coming. I'm going to do my session first, or my section first. This is the session on privacy. And I was talking with both Matt Roberts and Matt Bruce before we started a few minutes ago, and we were both agreeing that we might be the sort of the black sheep of the family here at this conference, because the theme of the conference is sharing, which is great. And I just want to make sure that I say up front that I'm all for sharing. But this particular session is about some of the things that you want to keep in mind before you share, because there can be things that go wrong, or things that you want to think about at least first before you share your data. So I think that's what we're going to talk about today. There's certain types of data that's more sensitive than others, and that's one of the reasons that we have to sometimes take care before we share. Next slide. And thank you, Matt, for doing the slides for me. So I think we can all agree that technology has outpaced policy in the area of data privacy, right? And that's one of the problems. What are the rules? We need to figure out what the rules are. We all have the ability to share, but do we always have the authority to share the data? So what I want to talk about are some of the questions that you can ask about your data and that you can ask yourself before you share the data. And I'm hoping that these kinds of questions will help us all think about what the rules should be and what the standards for data protection should be. First, I want to say that the answers to these questions are not going to be the same for all of us, and they're not always very clear. But I am hoping that going through this exercise will help us all to come up with some better standards and better ways of thinking about data. Next slide. So I think one of the first questions that we should ask is, how sensitive is the data that you're going to share or that you are thinking about sharing? Some data is much more sensitive than others, than other data. We've all heard about personally identifiable information, or PII. And we've all probably taken certain steps in the data that we work with to remove PII. It's usually things like name, social security number, date of birth, place of birth, IR number, which is the number that's attached to a fingerprint. But there's other types of data that can be identifiable, even though it's not necessarily thought about as PII. And that's usually the kind of situation that comes up when you're looking at data in the context with other data. So there's certain attributes of the data that could make it identifiable. For example, if I were given a list of employees at a medium-sized company, not something like Microsoft or Google, but a medium-sized company that had age and gender and department and salary, I could probably match up the employees to those data points pretty easily. And some people might not want me to be able to do that. So this means that we have to think about how sensitive the data is before we start sharing it, and possibly remove certain elements of the data or attributes of the data first. It also might mean that we want to put safeguards in place, such as password protection, encryption, that kind of thing. Next slide. So, whose data is it? That's the next question to ask. And I think that this is the question that you want to think about when you're sharing data that you work with, but also when you're sharing your own data, because your own data might be part of what you're sharing. If it is your own data, then you only have yourself to look to, because you're the one who's going to be making the decision about whether to share it. And if somebody else who gets that data does something that you don't intend them to do, then you, again, have only yourself to look to. Next slide. But if I'm sharing someone else's data, that's usually because I'm in a position of trust. And this is something that I confront in my work all the time as an attorney, my clients give me their data and I'm entrusted with it, and the presumption is that I'm going to keep it safe and confidential. So I really have to think about what I'm going to do before I share any information about my clients or our client database. And I think that's particularly true for other fields such as health and education, and fields that involve information about individuals that is sensitive information. Next slide. So after we think about the sensitivity of the data and whose data we have, we also want to ask ourselves, well, what are the risks if I actually share the data? And when you contemplate the risk, it's a matter of thinking about what's going to happen if unauthorized disclosure takes place, if someone that you're not intending to see the data actually does see it. Sometimes it could be very minimal risk, but sometimes it could be catastrophic. One example that I use in my work with the staff that I'm always talking to about data sharing and about our client data is if we have an individual with a consumer issue, then sharing their data might just mean that their name and address gets disclosed and they start getting harassing phone calls from a debt collector or whatnot. But if we have someone who is a survivor of domestic violence, sharing their data could mean that the person they're hiding from finds out where they are. And that could be a very bad situation very fast. So that's the kind of thing that I ask people to think about. What are the risks? Sometimes they're small, but sometimes they're large. Next slide. And part of evaluating the risks is evaluating the responsibilities. Attorneys confront this issue head on when it comes to sharing data because they have the ethical obligation to keep things confidential. That is true for medical professionals and others who have an obligation based on an ethical rule or a law that they need to follow. So it can get pretty tricky pretty quickly. Next slide. So some of the questions we should ask about the data before we share it. How sensitive is it? The more sensitive it is, the more safeguards we may need to have in place. Whose data is it? If it belongs to someone else and you're in a position of trust, and that's why you have that data, then you may need to get permission before you share it, or just make sure that you take certain steps to safeguard it before you share it. What are the risks of unauthorized disclosure should something happen? If they're small, then you may decide it's okay to go ahead and share the data. But if they're large, or could be large, then you may decide you want to take certain steps before you share it. Or you may decide you just can't share it after all. And what are the responsibilities? If you have an obligation to protect that data, then you want to make sure you meet that obligation before you share it. Okay, so next slide. Let's go on and say that we've gone through these steps. We've figured out that we've taken out the sensitive information, that we have permission to share the data, we're meeting our obligations before we share the data, and so it's permissible for us to share it. What are the typical ways we're going to share it? Well, we're usually going to go on the internet and share it in some fashion on a website. And that is something that people use a lot of times without thinking, like Google Docs or Dropbox or whatnot. When we go on the internet, typically there are going to be terms of use that come into play. And for all of the different websites that we go to, we often see terms of use, right? When we fill out a form to buy something on the internet, we typically accept the terms of use and move on, and we don't think about them anymore. Next slide. But when we're thinking about sharing data in our work, and especially data that is somebody else's data, or that is really our organization's data, then we need to think about the 4 basic concepts that come into play with terms of use. Ownership, access, storage, and destruction. So, next slide. Let's look at ownership. We've already talked about whether the data that you're planning to share is your data or someone else's data, but with terms of use, we also have to think about whether that ownership is going to change once we put the data online. Some terms of use will say, say things like, you agree that we can display your username or your likeness or your photo, or you agree that another business can pay us to display the actions you take on our website, or you agree that once you put the data online, it's ours as well as yours. So you probably want to take a few minutes to look at the terms of use and see what they say. Next slide. And when looking at ownership under terms of use, we also want to think about whether there's a reasonable expectation of privacy. Sometimes the terms of use will include that kind of a provision that we maintain your data as private and give you that reasonable expectation of privacy. But other terms of use may say that we will disclose your data if we determine that it's necessary for our business practices or for us to protect our rights. So that way, in that instance, the provider is telling you, we're going to disclose it, and we may not even tell you before we do. So that's something you want to at least know about before you start using the website. Next slide. So the idea of ownership also addresses accountability and liability, and terms of use can include a waiver of claims. That's something you also want to be aware of. Again, this goes back to the idea of risk and responsibility. If we think that a data breach could occur, then we want to make sure that we have some protection if it does. So for example, if a breach occurs, then the state laws regarding notification of the breach come into play, and that means that the provider of the website has to start giving notice to everybody who's affected by the breach. So as you've probably heard in the news, you know, people who shop at certain organizations, certain retail stores may have been subject to a data breach, and all of those people, I was one of them, got notices about the fact that my data, my credit card information, was included in this data breach. That's an expensive proposition. But if the terms of use say that the provider is not going to take that step and provide notice to all the thousands of people affected by the breach, then that responsibility may fall back on you. And you would want to know that. And you would want to see that, you'd be able to see that by looking at the terms of use first. In addition to all the notification requirements, there's also typically a forensic evaluation that has to take place if there's a data breach. And sometimes there's also remedial steps that have to be done under the law. So it can get very expensive very fast. And what I'm suggesting is that we all should know about this before we start using a website so that we can decide whether we want to use it in fact or not. Next slide. Closely related to the concept of ownership is the concept of access. And this includes considering how secure the website is in the first place. Is the data encrypted? Is a password required? Those are some things that can make the data more secure, make a data breach less likely to happen, minimize risk. Next slide. We also should think about government demands and subpoenas. The terms of use may say that the provider can disclose data if it gets a subpoena from a third party. So this is, again, something you'd want to be at least aware of. And next slide. This brings us to storage. Again, in terms of use, we're talking about ownership, access, storage, and destruction. Well, when it comes to storage, you want to kind of have an idea of where the data is stored and how secure the servers are. If someone can walk in and steal a hard drive, then the data isn't very secure. And next slide. The fourth concept is destruction. Again, you want to be asking yourself, how is the data destroyed? Is it destroyed? Is it truly destroyed? Sometimes people will say that they wipe their data after a certain period of months in their terms of use, but they don't really destroy it. They still have it. And it's not always easy or clear in the terms of use, and it's not always even possible to answer the question. But at least by reading the terms of use and understanding them, you'll be in a better position to decide whether or not you want to use that website for your data. Next slide. So to sum up, when we're considering sharing our data, I think we want to consider different things about the data and ask questions that we should be asking ourselves and maybe asking ourselves, but we have to sort of step back and make sure that we figure out the answers first. How sensitive is the data? Whose data is it? Am I being entrusted with it by someone else? What are the risks? And what are the responsibilities that I have to that data? Next slide. And when sharing online, we want to consider the terms of use that will apply. And so for every website we use, we want to ask ourselves, who owns the data once I put it online? Does the ownership change? Who can access it? Is the data, where is the data stored? And how is it destroyed, and is it truly destroyed? If we ask ourselves these questions, I think before we share our data, we'll be in a better position to take steps to protect it if we need to, and ultimately to develop standards for data protection overall. Thank you.
It's fine, I'll just sit right.
Oh, you can sit there?
Although they actually want to record it, don't they?
Yes. Yeah.
Okay.
They move the microphone closer
Yeah.
to me.
Hi, I'm Matt Roberts. I'm not an attorney, and Vivian, don't worry, there might be like a 15-second timer in there, but if it advances slides for you, it's okay. I'll just keep pace with the computer. I'm the Informatics Project Manager at the Chicago Department of Public Health, and I'm not an attorney, I'm not a doctor. I'm informatics, and like kind of not exactly IT, but sort of like that. And actually, hit the next slide. There is we're going to talk about our open data and data sharing policies and some things that that impact that. But first, I wanted to provide some background on informatics, and I'm speaking on behalf of the commissioner. So on behalf of Commissioner Trucare, who couldn't be here today, thanks for the invitation to speak. And so the Chicago Department of Public Health is the main city health agency. We work with FSS, Family and Support Services. Those are the two main health agencies, I'd say, for the city of Chicago. And we work with the Cook County Health Department and also the state of Illinois to perform public health services for Chicago residents. And so it's a complex system with complex laws, and I have some slides in here that describe some of the issues that we have. But just before I dive right in, so informatics is essentially, if you're not familiar with what informatics is and what I do, our role is largely this bold area right here, trying to help our public health system do its work better using technology, which is a difficult and uphill battle, but I'm committed and dedicated to the cause and striving for it each and every day. Essentially, this is I don't know if you've ever heard this word before, but it's an emerging word, an emerging field in business and in public health. Next slide, please. So many folks here, I'm sure, are very, very familiar with the open data movement, so I don't want to spend a lot of time dwelling on this. I bring it up to illustrate a couple things. First of all, there's plenty of years of history of this effort. And secondly, I showed this presentation to a staff meeting we had just last week with all of our middle managers. And the point of me bringing this up was to illustrate to them that this is many years in the process that this movement's been taking place. And whereas this may be new to a lot of the staff and folks that I work with, this is happening all around them, in the world around them, in Europe, in the United States, and it's something that we're very much committed to and dedicated to. Before I came here to the health, I've been with the health departments for about 9 months. Before I came to the city health department, I was with the state health department for 8 years, including serving as the communicable disease section chief. And I've always been a big proponent of open data and getting our data out there. I firmly believe that public data belongs in the public domain. And so I'm a big champion of this, and so that's why I love my new job, my new role at the city health department and being in charge of informatics, because this is in my division. It's a challenge to try to bring, but we were talking about change management here with Vivian and Matt before we started this talk. One of the biggest things we have to work on is change management, trying to introduce these concepts of open data and liberating data sets to our own program staff. That's one of the biggest challenges. And so I use this slide to articulate that this is not just starting because Matt's up here talking to them and trying to convince them to do this. This is several years that this has been in the process. And the key things here are probably would be that at the end of 2012, the mayor established an executive order asking all city agencies to release the data and do it. Who is one of our main sponsors of this conference, and Brendan Berman, I believe, opened up with some general remarks. They're kind of the people that are making it happen from a technical angle. I'm one of our, quote, like ambassadors internally within the health department to try to liberate our own data sets. And I'll explain more about that in a moment. But that was probably a big point on the timeline for the city of Chicago. And I think the Illinois side as well was also a big day. But that's that timeline. Go to the next slide, please. Thanks. So again, many folks here are very familiar with open data. These are the few main platforms that we work with. When I was with the state, in charge of communicable disease, I've really promoted the use of our publishing of our data sets on data.illinois.gov. And I'm proud to say that we have some data out there. I don't think all the stuff that I was expecting to get released made it to data.illinois.gov. But we have some infectious disease statistics and the like that may be useful to Illinois residents, including like the MERV rabies bites and stuff like that happen to occur every year. We track that kind of information, and it's useful to see over time to see which kinds of animals are causing rabies. And if the data is locked up for no good reason at the governmental level, then it really can't be used to help make these things better. So next slide. On the last slide I said something about 35 or so, or maybe I didn't say it, but we have about 37 or so data sets on the Chicago data portal, and 2 of those are updated in real time. One of those being our food inspection results, which we're very proud of, and the other one being environmental inspections. I'd love to take the credit for getting those posted. I can't. That happened well before I got here at the health department. One of the main reasons why we got those posted is because of this graph. As you can tell, one of the main reasons why government agencies decide to start putting stuff on the data portal is not because the mayor or the governor says please do so. It's because of FOIA requests. They're huge time drag and a suck on our resources, and so this is one of the best ways that we are finding to try to get our data out there so that we don't have to respond to as many FOIA requests, and it helps improve the population. I read somewhere that when New York City released their restaurant inspection data, I don't know how they measured this, but somehow they found a $100 million increase in people going to restaurants and consuming food because they felt, I guess in theory, they felt the food was safer. Again, I have no idea how they measured that, but it's a nice story and it sounds great. So if nothing else, we know that in government we should be releasing this data. If for no other reason, then you can take your number of FOIA requests from 1,800 a year to 1 a year, which is a pretty compelling story, I think. So FOIA is often like the first reason why governments release data, not because they're told to, but because they want to try to make their lives a little bit better. Again, I believe in expressing public value, and I think it's an important philosophical principle. And we may hold questions just to the very end. Oh, I'm sorry, that's a great question. The question was, what does FOIA mean? So Freedom of Information Act. Sorry, I'll use it as a verb and a noun, and I'm going to misuse it quite a bit in this presentation. But there's acts that have been put in place in just over the past maybe several years that require or allow governments to be able to release their information to institutions that want it to be released. Largely, we're talking about the press, media, and I'd say attorneys. They're looking for information on particular inspections and stuff like that, are probably the most common ones. But pretty much anything can be FOIA'd, and then it's on the government to release the data to the FOIA requester, unless it's like an unduly burdensome request. A lot of requests come in, people have no idea, and they just don't know. They don't know what they're really asking for, and so they put together a request, and it's a request that's probably just not really well refined. So we work with those agencies and those requesters to try to refine the request a little bit. So those are the two reasons. I'd say that if you want to hit the next slide, it's there's a lot of innovative technologies that happen as a result of releasing our data. And so folks that are here from the civic tech community or innovative entrepreneurial communities, these products right here that I'm showing on this slide, these are all results of our data being released. And so we're proud of that fact. I think that this is just the tip of the iceberg. As we continue to release more and more data, and hopefully stuff that's updated in real time, this will continue to be more and more useful for the public, and also for people to take our data and do things with it that's truly innovative and expresses that data in ways that we couldn't even imagine. This is something that we're not particularly good at, building mobile phone apps. We should probably leave that in the hands of the tech community. And so if we put our data out there, then we think that the groups will be able to move forward with it. Next slide. And I'll just breeze through this, but an interesting story. So on that timeline, one of the most recent things that happened was that President Obama, I think he issued an executive order that said to the effect, not only should we be releasing data in government, but everything should be open by default. And what that means is that we shouldn't think about, we have to consider our privacy laws. As we do so, we should think about how that data can automatically be released. As we generate and create and collect data, it should be automatically thought about being released. And one quick interesting story about that. So I always get pushback within our own agency whenever we try to release data because of 1,000 reasons. Again, there's a lot of change management and cultural shift within our departments to do this. So one of the common ones is I don't see how it would be valuable to be released. Why should we even waste our time and energy trying to release this data set? And I bring up this New York State and Hurricane Irene example because it's kind of interesting. So New York State is and New York City are one of the leaders in this entire movement. And one of the first data sets they released was the nursing home bed availability that's updated on a weekly basis. So if people are in a residence of a nursing home, it's just being updated, and the bed counts are being updated in every week. And it sounds like an incredibly boring and mundane data set, right? That's who cares about the bed availability. But this happened just a little bit before Hurricane Irene hit the New York area, and the nursing home administrators, the state health department, lots of folks are able to use this data set in real time to plan shifting residents and patients of those nursing homes from the areas that could be impacted to safer ones out of harm's way. And so that's a great example where you release the data, who knows if it'll be useful or not, but there's unintended great advantages of doing this sometimes. Okay, next slide. Okay, now I'm in wet blanket mode. All right, so again, I'm a firm believer in doing this. We have several reasons why we have to be careful about doing this, and some of those are listed in this slide right here. The first being the agency's capacity. So again, I mentioned cultural shift, change management. You have the mayor saying, please go forward and do this. It sounds great. And then you have people that just don't want to do it, or they don't have the capacity to do it. There's very little incentive to do it. In some ways, this could be embarrassing data to release, right? They're releasing their statistics on, let's say, one stat that we have out there, a performance measure, is the percentage of STD clients that are turned away from our clinics at any given day based upon we're just understaffed or whatever. In some ways that's embarrassing, and that's problematic for our different clinics. They don't want to release that kind of data. So either it's due to internal pressure or internal resistance or just even resources. A lot of our data is not very clean to begin with, and so organizing it and putting it into a fashion that can be placed coherently into the public domain is a challenge. And not a lot of our data is complex, and so a lot of programs don't have the epidemiological or statistical capacity to even prepare the file format to get the Excel spreadsheet ready, in other words. So there's a lot of learning curve in getting this built up internally. Then there's interpretations on the how to interpret the data, right? So we can release any data file we want, and it can be immediately incorrectly interpreted by anybody, right? So one not so famous, but one really recent example is Medicare recently released the 2012 statistics for claim reimbursements, I believe, by providers, healthcare providers, including physicians, for 2012. And this was, I don't know if you guys had heard about this. It's a mammoth, like several million record data set. I recommend you all check it out. CMS's website. It's a super data set, but it was immediately misinterpreted by the media. They drew very spurious conclusions based upon the results, and I don't want to go into a ton of detail about it. And it's a good exercise, really, because the press was the first to really dive into this data set and start making conclusions and interviewing physicians and the like, and they just made some wrong guesses about what the data meant. But it was a good example to show that we can post all the data sets we want. An important piece of the story is helping lead the consumer of that data into the proper interpretation of that data, because you can really jump to the wrong conclusions if you don't have an understanding of the background of the data. So that's a concern that we're trying to wrap our heads around. And then probably the stickiest and trickiest part of all this is the privacy piece and the privacy laws. So hopefully everyone here has heard of HIPAA. It's HIPAA, the Health Insurance Portability and Accountability Act. And we have just in Illinois, that's a federal law, but even in Illinois, we have 19 different laws that govern how health information is managed and secured. That's a lot of laws to, it's when Vivian was mentioning that technology is outpacing policy, I think that's an example of why. We have a really complex legal or legislative apparatus, and these laws are in a bunch of different camps, and it's hard to get these things updated, as you can imagine. Just an example on how we can sometimes get it wrong and why it makes us a little gun shy. So again, before I took this job, one of my jobs at the state health department was I was in charge of communicable diseases. Before I had gotten there, we had had a really exceptionally difficult West Nile virus season. And in an effort to try to let people know, let the public know about the severity of the disease and how it could impact certain populations, the folks in our section had released a little bit of information about some of the patients. They'd essentially released the date of death, I think the gender, and the age. And that doesn't sound like a whole lot of, that's like essentially 3 pieces of information, and I should say it was also down to the county level. That's not a whole lot of data, is it? That's 4 data elements. But if you, and Vivian mentioned how different data sets can be paired up, if you take a look at the obituaries in a small county for any of those given days where the date of death was mentioned, you could pretty quickly figure out who the 84-year-old male was that had died from disease X. And then right there you know that, Bert or whatever died from West Nile virus. And that's that's an example of where we can get it really wrong really quickly. And really, in a small amount of data fields, as I said, there's like four data sets completely implicated that patient. And that's something that's wrong. We don't want to do that. And so we're trying to learn from these mistakes as we try to release the data. We really do want to help protect the public's health, but there's ways to do it right and there's ways to do it wrong. And so we're still grappling with these issues. This slide is about data release, but even data sharing internally is an issue. HIV laws at the federal and state level are more, they bring the security even tighter than a lot of other public health data goes, just the way the data's set up, including who can access it. So we even have a hard time sharing data from our HIV bureau with the people that handle hepatitis and tuberculosis. And those 3 diseases are really closely linked. And so it's important for those groups to be on the same page, but we have a hard time even sharing data internally, much less getting it out to the public. And so I hope that it helps you guys understand some of the complexity of how this goes. We're working on policies all the time. The National Center for HIV/AIDS and STD and TB has come up with a nice new protocol to try to bring all these different programs on the same page as far as how their internal procedures go, so that there won't be this reason for not sharing data internally. But it takes time for these things to kind of come into effect. The next slide, maybe? I think I'm close to being almost out of time here. So just briefly, again, HIPAA is one of the main laws here, and this is not my slide or concept, but Dr. Corman is in charge of our Institutional Review Board, our IRB, and this was his concept here. The balance that we always continue to draw is trying to get as much information out that we can while protecting patient privacy, but also having the data release be useful. So it's a balance we're trying to seek. The next slide. So here's one of the questions that was kind of asked at this conference is, what can this ecosystem do to help? I feel like these are two kind of overt ways to do it. A little more subversive would be to light us up with FOIA requests. As I mentioned, one of the ways to respond to help us get our data out there is one of those reasons was a lot of Freedom of Information Act requests that came through. And I'm not asking you to light us up with FOIA requests. Please don't. Again, I'm going to try to get as much of our data out there, but that seems to be one of the ways it's most effective. So with that, thank you for your time, and I know Matt is up next.
Hello, I'm Matt Bruce. I'm the Executive Director of the Chicagoland Workforce Funder Alliance. I don't have a presentation, but I'm going to try to talk through actually some real world examples about some of the themes that we've heard. We didn't actually set our order, but I'm glad I'm going last and try to touch on some of the themes. So we are a funder collaborative, the Workforce Funder Alliance. So actually I sit right next to Dan O'Neill at the Chicago Community Trust. We're both hosted there. My funder collaborative is about 12 different foundations, some of them corporate funders, who all fund in the workforce development space. And so I live in the workforce development world, and sort of shorthand, just a quick description, that's the world of training programs, the bridge between education and careers, and all of my funders fund in that space. Some of them fund direct service, some of them fund policy, and the concept of our collaborative is that they pool funds together, and then we do sort of strategic initiatives in the workforce development space. So I'm going to talk about real sort of on-the-ground data sharing issues and questions or challenges that come up in the workforce development space, but I think it's a lot of the same themes. We are a very fragmented world in terms of social service. So workforce development crosses over a lot of different policy areas. Housing, economic development, community development, anti-poverty, public health. The thing about workforce development is that any interest you think of has some sort of workforce implication, and so all of them have an interest in having a healthy, vital workforce. And so what that means is that there's many different funding streams for workforce development programs at the federal, state, local, and of course philanthropic. And what that creates is a very fragmented, siloed system and data in each of those different silos. And so we are sort of ripe for this challenge and also opportunity of data sharing. There's two instances that I'll talk about where this data sharing comes up. One is that we are invested along with our partner, the Chicago Cook Workforce Partnership, which is called the Workforce Investment Board for the city and county. They are the administrators of the largest federal program for workforce development, or one of the significant ones, depending on what you count as workforce development, called the Workforce Investment Act. And they have a network of about 40, I think 8, maybe in that region of different, what they call delegate agencies. And so they channel federal funding to about these 48 partner agencies across the city and county that do workforce development work. And so this is helping people find jobs, training people. Many of them work with special populations, whether youth or ex-offenders or people with disabilities, the whole gamut of workforce development. And what we're working on with them is a shared data system that they're developing for their network of delegate agencies. And many of those agencies are also funded by our foundations. And so what we are trying to develop is a data system that helps break down those silos that can be used across funding streams. So there was sort of a scan before this project really got off the ground that looked at these CBO agencies that are doing this workforce development on the ground, and some of them are using up to like 9 different data systems. And I use data system loosely. That could be an online system, it could be an Excel spreadsheet, it could be an internal access database, but they're entering data about their participants, the people they're serving, in as many as 9 different places, or at least the average is more like 4 or 5. So it's a significant amount of energy and sort of expense, time spent on just the data management side. And a lot of this is just reporting to funders about what they're actually doing. And so the idea of the new system is it's not going to eliminate that, but we hope it can make it better. And we hope at a minimum, the foundation grants, we can use this new system to get the kind of data reporting that we want from grantees, so they won't have to set up an external spreadsheet or database for the sake of the foundations at least. And it does bring together a couple of the different federal funding streams as well. So we're involved with that in sort of a capacity grant to the Workforce Partnership to help them implement that. And the other thing I'll mention is that I'm involved with Thrive Chicago. So this is a collective impact strategy, the cradle to career strategy that the mayor's office is incubating and will eventually spin out. And I facilitate one of the 5 different change networks. So there's all different change networks along the spectrum of cradle to career, and I facilitate the one that's related to employment. We call it employment at living wages. And so I won't talk as much about our change network, but certainly Thrive as a endeavor is working a lot on data. And actually more at the center of it is a lot of this actually came out of the realization that all these investments were going into youth, and there was no clear way of understanding those different investments. And so CPS had a picture of a student from their internal data systems, but then there were all the other investments, whether from after school or the Parks District or different CBOs programs, and no one had a sort of unified picture about all the interventions that particular student was getting. And so Thrive, part of the theory of it is this collective impact. If we understand what our investments are collectively, we can align them better. And so really this theme of collective impact, it's the same thing for the Workforce Partnerships new data system. The idea is, if things are so siloed and fragmented and there are many different investments but all pushing in the same directions, the theory of collective impact is that if you align those investments better, if you're pushing in the same direction, you can have more impact, even without additional funding. It's about sort of doing more with the investments that you currently have by coordinating it better. So a big part of this theory of collective impact, I'd say in both examples, has to do with data. And so if you're going to align your efforts and really push in the same direction, understanding what those efforts are in real time with real people is really where the promise lies. And so knowing what other parts of your sort of collective impact are doing, whether that's another program or another institution, is sort of what they're trying to achieve. And so I'd actually say there's a case study in itself in terms of the data agreements that Thrive has been working on, with CPS at the center of it, but many other different systems, and the work they've had to do over the last year and a half with the lawyers and all the different departments. I'm not going to go into that as much, but I think what I wanted to talk about is sort of 4 themes or questions that have come out, that I see have come out of from both of these experiences. And I think they really draw from the earlier points. So one of the things that both instances have dealt with is the question of who needs to know what and when. And so I think the difference is that this has always been a question that agencies or institutions have had to deal with internally. So if you have a data system that is tracking data on participants served or clients served by an agency, agencies have had to figure out that question if they have a system that they're using as an agency. Who within our agency gets to see what? And so if you have someone who is on and a social worker's caseload, that social worker can see very sensitive information about a person. Who else can see that information? And agencies, I think, have gotten pretty good at making those rules and having their system enforce that rule so that maybe the supervisor can see that, or other people that are on the same sort of delivery of care team or whatever the terminology is can see that. But certainly other people in that agency who don't need to see that can't see that. And so this concept of shared data and shared data systems going beyond agencies, looking at how we're trying to impact these issues, these challenges, whether workforce development or anything else, collectively across different institutions and agencies, just blows that question up about what do staff need to know outside of the agency. And it's really a question of benefit. And I like that balance chart and the talk that Vivian started with about risk. Is you really do have to think about this about risk versus benefit. If the benefits really aren't high, then the risk doesn't have to be high to make it not worth it. And so we really need to, especially when we're talking at this level, I guess the point I should have made at the beginning is that the kind of data I'm talking about, which is one-on-one data between a participant or a client or a student and the entity or the program trying to serve them, is very sensitive data for the most part. It certainly has personal identifying information, and I'm not so much talking about getting that data out to the public, because then you could talk about scrubbing and aggregating data and doing it in ways that protect privacy. I'm talking about sharing the data within our systems so that we're actually working with individual people better. And so when you're talking about that level of individual people, that data is very sensitive. It can have information about their past work history, past health history, past criminal justice system history. And so we do, I would say by default, the kind of questions I'm talking about are in that sort of very sensitive level. And so while it doesn't mean that sharing can't happen, we have to have sort of a very high threshold and a lot of thought about how that sharing happens across these different agencies. So the second question or theme that I wanted to sort of bring up or highlight is the objectives of the sharing of the data. And so I think if we are sharing this data across agencies or across institutions, we need to be also sharing the objectives of sharing that data. And so one objective could be to serve the individual better. And so I think that's sort of the first one we think of, that, you know, if agency X is serving a person and then they also go to agency Y, either at a different time or at the same time, shouldn't agency Y know what agency X is doing to some extent so that they can do their job better? And so they don't have to re-enter all the same information or take the whole huge intake case study history of that person about what their needs are. When we make the system more efficient, if agency X and agency Y we're sharing data about that person so that they can work together on that person. So that's the first thing we think of, is maybe we could share data so that that person, the individuals, benefit. There's also the objective of sharing data of the agencies themselves benefiting. So they could do a better job as a program if they understand how their program is interacting with other programs, if they see the benefits of patterns in terms of how they are fitting into an ecosystem, and also being able to compare themselves to other programs. We talk a lot in the workforce, at least in the funder space, we talk a lot about benchmarking. And so if we can sort of benchmark different programs and know that, you know, this is sort of a standard of excellence for a program that's trying to get ex-offenders jobs, we can help them by looking at data across programs and show that this program is doing really well. Let's look at what they're doing and let's adopt some of those best practices across the system. And so there's agencies stand to benefit from sharing this data. But the third is the system itself. And, you know, does the system, one of the objectives, and the funders certainly go here, is if we're sharing this data better and understanding these investments across different agencies and institutions, can we see where institutions that aren't, or agencies or programs that aren't performing well, how do they stand out from programs that are performing well? And you also sort of getting to the individual level, looking across the system, we know that just as in healthcare and workforce development, we have individuals who use program after program after program, and we don't always know it because we're siloed. But if you get from a systems level, you can see that sort of repeat use. And so, but those three interests or benefits are not always in sync. And so the individual, you know, might not want all this data to be shared so that the program knows this is the 6th workforce development program that they've enrolled with. Because does that make it less likely that workforce development program is going to serve them, because obviously they are a harder person to serve if they failed, you know, 6 times previously. Agencies might not want funders, and we've had these conversations with agencies to really have this sort of global look at who is performing well and who is not performing well, because of course the fear is that the whole story won't come across for them. Funders will see what they think of as low-hanging fruit of programs that they can not fund, so they can fund programs that seem to be performing better. And so there's that fear there. The third theme I wanted to talk about is this question of what a release of information means. And so before we really got into systems that could share data really well across different agencies and institutions, there was always this concept of release. And so when you are working with a program that's trying to serve you, you sign a release form and say, yes, you can know this information about you. There's usually information about there, and we talked about sort of terms you use, that, yes, you can report to your funders in aggregate about who you're serving so they can look at things in aggregate. And so with this new ability to share data across institutions and agencies, that release will need to change if we are going to share data. And the question of, you know, how much does it change, and how much do we also need to think about making sure that individuals understand that what you're signing off, what that really means. It's not just this agency. If they are working in close partnership with other agencies and that release means that those other agencies can also see that information. The individual needs to understand that. There's also a real question of time, because this gets to the sort of destruction of data issue as well. Data does not go away unless you make it go away, and you could have someone who has signed a release that was served by the workforce system 1 year, and 5 years later they come back to be also served again by the workforce system coming to a career center. Does that individual have an expectation that their information will then still be there, that they will have known about this previous interaction with the workforce development system? Is that really a reasonable expectation? Is there really a benefit to that? Do we need to know that they were served 5 years previously? And so it's raising all these different questions about what are we really releasing? What are we asking people to do? And the final thing that it raises is again, this ties into the issue of like risk and responsibility, is if you're sharing data across different systems and you've figured out how you're shared, you have sort of shared objectives and shared ownership of that data, at the end of you have this huge question of where the liability ultimately lies. And that can be a real barrier to sharing the data. And I think this has been something that Thrive has had to deal with. If you are connecting all these different data sets across different agencies and institutions, there's always that risk that something could go wrong or data could get out, some of the things we've already talked about. What agency or institution is willing to take on the liability for that, to sort of own the sharedness of that data? And it's very difficult for a CBO to do that. It's even very difficult for very large foundations to do that. They don't want to do it either. Really, you really need a large public institution to sort of be the backstop to that liability. And it really does get to the risk and reward question. The benefits really need to be great enough and bought into enough and seen enough for them to sign off on assuming that liability. And if that doesn't happen, then the data sharing can completely fall apart. So those are the things that I wanted to highlight, and I wanted to leave time for questions. We didn't talk for too long. So we're just going to sort of self-facilitate, but are there any questions from the...
Like this thing with the cloud, okay, like, so, we've seen stuff in the media with celebrities, but as far as public health, like, let's say hospitals, like you're in the hospital, and so you fill out all this information, okay, and it goes into the computer, it's on record, and it goes into the cloud, okay, and I don't know, like maybe you don't pay your bill or insurance goofs up or something, and you never hear from them, but maybe like somebody deleted it, but 10 years later it shows up from the cloud. Like, are you still liable for it, or whose fault is it for not getting you that information sooner, or how long does it stay in the cloud, or what happens if the person dies and the documents, like, what do? Do you delete everything that's on the computer, and is the stuff in the cloud deleted, or is it forever in the cloud, or, I mean...
All good questions, right? I think that data never goes away, really, once it's in the cloud, because you can't control it anymore. So, and it's going to depend on who is being harmed by the potential lack of data or continued existence of the data. That's part of the question you're asking, I think.
I don't know, there's so many, things, like, what happens when a famous person privately goes and has a medical test, has an STD, and he wants it kept private. And so you delete, the information from one thing, but it's in the cloud, but somebody accesses the cloud.
It's one reason we have so many laws,
Right.
unfortunately.
And so I won't go into a whole lot of detail about the cloud itself, but if the cloud is designed to be a way to help manage data, with servers and all the like, because servers are expensive to maintain and upkeep by governments or by anybody, There's ways you can tie down and provide good security constraints within cloud-based systems, of course. That said, this is a completely new territory for, at least for the public health world. I can tell you that there only recently has CDC been asking states and local health departments to begin exploring cloud-based usage for their disease registry and repositories for infectious disease data. So like your STD example, that data is collected and maintained currently within state databases, and we have good security protocols, we think, to try to keep that information secure. But putting them into the cloud is new territory for us, and we had the same reluctance to do so, I think, because we're worried about some of these issues.
And what happens if somebody, like, you know, an employee, like, finds out this private information about the celebrity,
Mm-hmm.
Right.
and just takes that?
Yeah.
Right.
Do you guys have safeguards to keep employees from stealing information?
Sometimes people do. I mean, Google, one of the things that Google says is that they share all their information with all 33,000 plus of their employees. So when you think about it from a practical standpoint, people who work at Google don't have time to go poking around to see everything that's out there, but they could. And they could stumble across it. So anything that Google has, all of their employees have. And they are upfront about that. And that's just one of the things you have to decide if you're going to use any of Google's services. If you want to.
But who's responsible? Is it the doctor's office then, or, you know, I mean, who gets in trouble if I am completely embarrassed and,
Right.
you know, who do I sue?
Right. It depends. Yeah.
Sue the government. No, I think so. We have some of our HIPAA training that we require, and like we have annual certifications that people have passed certain pieces of training. One of the things we have in our annual HIPAA training, I don't know if Matt wants to chime in too, for health, is that staff recognize that when they access these data systems, they're accessing data systems for discrete particular purposes, and not to go search for boyfriends, girlfriends, celebrities, etc.
But that's happened.
It does
Oh,
happen.
sure.
It happened at Northwestern.
Right.
You know.
Right, it does happen. So we have these things in place to try to correct that and protect that. They're not bulletproof by far. It happens in California all the time. We have Hollywood out there, so you hear about this stuff in the press quite frequently. So these systems they're getting better, and they're not perfect yet. The chance and risk of having somebody, one of your staff, that just wants to do the wrong thing, that happens. So I don't know who you would sue. I don't know the answer to that, but
Are doctors, are they being trained in, you know, like HEPA and like don't take selfies with your clients,
Right.
or, you know, you're documenting? I mean, there was a doctor who took a picture, was it a couple years ago, of a drunk patient because she was really cute, and he posted it on his Facebook. I mean,
that's so not okay.
I
Yeah.
know,
That's
Yeah.
just so
right?
bad on so many levels.
But
yeah.
I think one of the issues you're raising is that on the privacy side, there's the technology side to it and getting those things in place, but then there's also the human side to
Right.
it. And I think with all the system we're talking about, if you don't have both pieces, it doesn't work. So like the training of people who are actually going to use those systems is really important.
Excellent
Another
point,
question?
yeah.
Technology can help you in that instance too, because if you see an employee, if you happen to notice that your employee keeps looking for Brad Pitt or somebody,
Right.
or anybody in Chicago that's quote unquote famous, if they continue to do those kind of searches, there's a risk. There are things that can actually use the technology to catch people doing
Right. There are
Yes.
definitely
Yeah.
tools out there that will
Yeah.
let you know when people are doing certain things over and over again, accessing the database that they have access to for things they shouldn't have to do. Yeah.
Other questions? Yeah.
Yeah, well, I had a question specifically for Matthew. You had brought up the example of like when a minimal data set had been used and still exposed a patient. And I was curious, do you think it's an issue of, I'm kind of new to this conversation, but one time I had a job working for the state government, processing like Medicaid and food stamps or whatever, and I thought it was always interesting about how certain departments you couldn't get information from like Medicare, insurance, you know, to figure out, you know, just different things like whatever, data sets being shared. I think that's really interesting across departments. But my question here is, it just a matter of reframing the question. Was that the issue of like why the person was exposed is because of the question that's being asked? Does that make sense?
Well, so again, it was just a handful of data fields, and
Yeah.
if you look in the obituaries for the newspaper that was printing it, then you could just type, you know, 1 and 1 makes 2, I guess. So I don't know if I fully understand your question.
Like, how can you use data in that instance when that person was exposed? What was the question that was being asked to share this data, I guess?
Oh,
Is
so
it
the,
like a matter of like, I feel like, are we at risk? Is the issue of privacy sometimes because of the questions that are being asked?
yeah.
So is it about reframing the questions or like,
Right.
I don't know, that type of
Exactly. You know, that I understand your question, I think. In this particular case, we wanted to try to describe how West Nile virus was impacting certain populations,
Oh.
and we knew that elderly people in particular were disproportionately impacted by the West Nile virus, and so we really wanted to get that message out, right? And so we wanted to provide as much information to the public so people could take some precautions because this particular characteristic here is going to be at highest risk. So it wasn't even we were being asked a question. We just wanted to try to proactively do it. But to get to your question, I think, yeah, so there's 2 ways to release data, right? So you can release aggregate data, or you can release, the best way to do it, best case scenario is releasing record level data. But there's real issues with that because, as we can see, just 4 pieces of information, one of those was very identifiable, in particular the date of death, right, in the county.
Right.
And with that alone, you can just go right to the obituary paper and see who exactly that patient was. So if we identify, there's about 15, 18 or so different identifiers we know you just can't release anymore, we can still release some record level data. It's going to be very minute, just a handful of columns, but that's better than releasing aggregate data because it's more granular. We know that as we develop our systems and people ask different questions, we can figure out better ways to cough that data back up in ways that is going to be both useful and balancing the usefulness and also the release of information.
Right, and it was a small number in a county, so most date of death notices are by county, and most people know that. So maybe combining the counties can help. That's another way to think about it.
Yeah. In the back, Andrew?
I was curious what with all of these giant data breaches going on, whether your departments have any kind of like standards for like 2-step verification processes or like public key encryption, or whether messages are encrypted or drives are encrypted, or whatever. Is that part of the work? Is that part of your day-to-day or?
No, I'm not the 2-step verification yet, certainly. And I think the encryption is for the new data system they're developing for the partnership. I think encrypted both ways. But I also think that there's a divide in terms of people's understanding of that. So like when you're developing a new data system, there's such a information disconnect between those who are developing the system and sort of understand data and security and those of us who don't live in that world. And so a lot of us sort of rely on the technologist or whoever is, the tech vendor will say, yes, this is, perfectly secure. And I think that can result in probably some of those data breaches if due diligence, wasn't fully done on the side of where they don't understand the true security implications.
And just to build on that a little bit, at LAF, we do legal work, and so we have a case management system, and it's web-based. But we have a contract, an agreement with our provider, and one of the provisions is that all the data is encrypted. And that means that people can use a public Wi-Fi, and still access the client case management system, which is very, very helpful if they're in court or at the client's house or somewhere and they need access to information in the client database. But what I have found is that just on the issue of training, we can train people, but we have to remind them and retrain them because they forget, well, which website can I go to? Can I go to our case management system using Wi-Fi? Is that safe or not? Or they just don't think about security at all and they just start going everywhere. on the internet that they can go. So it's a matter of constantly keeping in mind the human element and retraining and reminding.
And I would say from the health perspective, it's a broad range. There's a whole lot of new things coming through federal CMS to try to get practices in health providers, doctors, hospitals to get their data from a paper format to electronic format. There's obvious benefits to this. But the range and scope of sophistication is very wide. You got people that are just starting off and they just advance from the paper age, and you got people that have very secure, robust, super encrypted data sets, and it's everything in between. And we're still working on these protocols internally. I can tell that's definitely the case. The Office of National Coordinator for Health IT just released not long ago a 10-year strategy for interoperability. This is 2014, so we're looking at 2024. That's the simple math on that. So quite some time to get us to the truly interoperable state, and then security is a big piece of all of this.
Question. There's a system being developed by some university in Chicago, where they're going to put up these data things to collect environmental information, basically, like temperature, foot traffic.
Yeah.
And so then everybody was freaking out that their faces were going to show up.
Mhm.
They reassured everybody that that's not going to happen. So that's good information for people that are at risk, and there's populations that are at risk for asthma and for probably, viruses being spread. If you see a big outbreak, as a group of some CPA car, that one needs to get off the train line. So, I mean, it can be really useful information, but my question is, how do you track that, and how do you tie that into other information? And how do you tie that into people going to the doctor? So you collect this somehow, but how do you transfer it to make it usable information?
I'd say very clumsily right now. There's a lot of new techniques that are being there as technology continues to improve. There's lots of different ways to capture and collect more data, and I think that it's something that we're very good. We're not very good at. We're pretty good at collecting data in the public health world. We're not very good at integrating data. We have 120 siloed data systems within our own department, and I think CDC counted 400 different surveillance systems for all the different stuff that they do. A lot of them are siloed. And so we continue to come up and establish these new systems, which is super. Not so super when they're not connected to one another. And then even analyzing the data is another challenge. That's why we want to release more and more of it. So it's a considerable problem.
Well, the environmental impact, the pushback you get from all these big corporations is that you can't prove that.
Right.
You got Petco on your windowsill. Hello. It's really frustrating from an individualistic point of view, or even a small community.
Mhm.
We all get it. If I go out on the ozone action day, I know. I get it. And I pay attention to it because it personally impacts me. But the challenge is taking that data and making it usable so that the policies can come up correctly to help everybody, and not just that neighborhood. It's not my neighborhood, so I shouldn't care about it. No, I should care about it.
Sure. Yeah, it's a real
Absolutely.
challenge.
Absolutely.
Chris?
Chris Rock, bottom line. I come out of the education space, and I just want to thank you for taking on a very tough topic. Particularly in education, I've noticed that things like FERPA interpretations of FERPA can change over time, and so my question would be, and I don't know if there's a right answer here, but is it better to see an interpretation of an old law or policy get implemented differently over time, or is it better to actually have a new policy around what's, for instance, in FERPA, what's a legitimate use of data for an education purpose? I'm just curious your take on that.
Wow. Yeah. Well, I'm not familiar with the law that you're mentioning, but
Family educational right to privacy.
right. I mean, I'm sure it's one of the many privacy laws that we have.
It's
And,
education.
right. And so I guess it would partly depend on what your goal is. A lot of times we can make the current laws work for us and just say that things have changed and we have to interpret them a little bit differently. And that does happen slowly over time, very slowly. So in some ways it might be better to try to advocate for a new law right at the legislative level and eliminate any problems with the old law just by writing a new one. But that can be a lot of work, a lot of grassroots organizing and lobbying, and it doesn't necessarily happen faster. So it's a hard call to make as to which way would be faster to achieve the goal. But it's a good question to ask, and to keep thinking about.
Yeah, I think probably some of it hinges on how much of a barrier the current interpretation is having to the objective you want. I think different organizations, and it probably depends on their culture as organizations, react to those things differently, where in some ways something like FERPA can almost serve as a crutch or a defense to say, oh, well, we can't do that because there's FERPA. And you don't understand that FERPA stops us from doing that, and so we just can't even go there. And so if that's the predominant sort of culture, then that might argue that, yeah, we really need to change that, because changing it, although that's an uphill battle too, is a more realistic way to get to where we want to go than changing the cultures of all those organizations. Now, I don't honestly know what that call is. I think some educational institutions approach FERPA differently, where they're like, oh yeah, it's there, we understand it, we have this release or that release, this is how we deal with FERPA, so we're still protecting privacy, but we're, meeting the ends that we need to meet in terms of how we're working with data. And I'm just not familiar enough in Chicago about like where the current culture is.
But that's the starting point.
Yeah.
You had this quote, Matt, workforce development and fragmented data systems are ripe for data sharing. So I was thinking about the marketplace and companies, like when they do hiring. Do you envision that maybe in the future people might have, when you're hiring people, you might have a database and pull up stuff of people, or maybe going back to make sure, instead of a resume, maybe making sure that they actually went to school and did all those things that they're saying they did.
Yeah. This is an interesting question. For me, it brings up this question, what we were talking about before with culture change, and how culture change and data tools can, in an ideal state, they go together. And so the culture change that I would sort of highlight in the workforce development space is, instead of all this network of delegated agencies who are all trying to get people jobs, instead of them seeing each other as competitors and competing against each other and sort of holding tight their own relationships with employers that they try to get people jobs at, if they act more like a system and pool, these are all the candidates that we're all trying to serve now and trying to get jobs, and pool all their employer relationships. These are all the employers that we are working on and developing relationships with and trying to get jobs, trying to fill jobs at. As a system, they are more productive. And so a data system can facilitate that. They can have a data system where there's one job order from an employer and the whole system sees it, and they've pooled together their candidates who they're all trying to serve. And when that job order comes in, they can have the best candidates go to that employer and make the employer happy, sort of as a customer as well, and that employer comes back. And so by working together, you are having better outcomes on both sides, both the participants who you're trying to get jobs and the employers who you're trying to get people to. That's the theory, and the culture change is as important as the data tool, because if the agencies don't buy into that and say that, no, we're not really all on the same team, we don't want to pool our employer relationships, then it doesn't work.
So you got to sell it to them.
Yeah.
You got to
Question?
show it to them.
There's a piece that's missing here that the data system can't capture, right? Which is sort of the trust relationship that somebody builds up with an employer relationship or an employer that places them. So the implicit knowledge of I've gotten a number of quality applicants to this particular person, and if you open that up to other people, then you lose that sort of.
Yeah, so actually the way, a good example, something called WERC, WERC, which is actually more of a grassroots. It's not like an institutional thing. It's a bunch of CBOs that have basically all their job developers work together. And the way they overcome that is that they don't share the employer relationships with everybody. The employer maintains a relationship with, say, Inspiration Corporation is one of the CBOs that's part of this. So Inspiration Corporation has that relationship with that employer. They don't then share that with all the other CBOs in the work network. But when that employer, say, wants to hire 10 cashiers, and Institution Corporation doesn't actually have 10 people that are ready to go right then they go to the work network, and Kara is on that network and Jarek is on that network. And so they would say, oh, well, we have 2 people who could serve those, that would be great for those cashier jobs. They get shared, and the Inspiration Corporation maintains their positive relationship with the employer, and the other CBOs get a couple of placements that they might not otherwise have gotten. But you're absolutely right. The data system doesn't capture all the other aspects of that. The trust, not just trust between the CBO and the employer, but the trust between the CBOs themselves, that they're going to trust each other and be in this network and not send each other bad candidates and not try to steal each other's employers, things like that.
Yeah. Good question.
So I think we're actually past time, so I don't know, we should probably...
Thank you all.
Thank you all
Thanks.
for coming.
Nice job, fellow panelists.
You too. You too.
There's no good answer.
Good questions. Good answers.
I mean, the social norms on this just aren't established yet either. So, like,
Yeah.
So God, all those different data systems make my head spin. It's just-
I could.
Oh, okay. See you.
Yeah.
You good to
Thanks,
meet
I'll
you,
probably
too.
see you in the future.
I hope so. Yeah.
I could spend hours upon hours each day, every day trying to sort it all out. Yeah.
Amazing.
Yeah, it's a problem. It's the nature of laws, but also just drift and
Right.
categorical funding. Like we want to fund
Oh.
this one thing, and
A
it's
big
not.
part of it is the funding.
Yeah.
Absolutely.
Thank you.